Streptococcal infections. Most people have probably had a streptococcal infection at least once in their lives. Strep throat, for example, is a common illness caused by Streptococcus bacteria. It typically spreads through respiratory droplets when an infected person coughs or sneezes. In many cases, streptococcal infections are self-limiting, meaning they go away on their own without the need for treatment. However, in rare cases, the immune system may overreact, producing antibodies that attack healthy tissues instead of the bacteria. This can lead to rheumatic fever, a serious condition that can damage the heart, joints, and brain. Rheumatic heart disease, which results from untreated or poorly treated strep infections, can be life-threatening if not addressed early on. For most people, though, a round of antibiotics clears up the infection without complications. Gas gangrene. Nothing illustrates the horrors of World War I quite like the diseases that plagued soldiers. One particularly gruesome infection was gas gangrene, a condition that became synonymous with the trenches. Soldiers who suffered deep wounds from bullets or shrapnel would sometimes develop symptoms within hours or days. The infection would begin with intense pain around the wound site, followed by blisters filled with foul-smelling gas. As the bacteria spread, the skin would turn a red-bronze color, becoming crusty and necrotic. Gas gangrene was caused by bacteria entering deep wounds where oxygen was scarce, creating the perfect environment for the bacteria to thrive. Treatment options were limited at the time, and the infection often led to amputation as the only hope of stopping its deadly progression. Even then, soldiers on the front lines had little more than bone saws and alcohol to rely on for surgery. Without proper treatment, the infection could spread throughout the body, leading to a slow and agonizing death. Whooping cough. Whooping cough, also known as pertussis, is a highly contagious bacterial infection that can cause violent coughing fits. The bacteria are spread through the air when an infected person coughs, sneezes, or even breathes. The hallmark of the disease is the whoop sound that occurs after a fit of uncontrollable coughing as the person struggles to catch their breath. The bacteria don't set out to cause harm, but as they multiply in the lungs, they produce a toxin that irritates the respiratory system and triggers severe coughing. The coughing can become so intense that it causes vomiting, urinary incontinence, or even rib fractures. While vaccines have made whooping cough less common in many parts of the world, outbreaks still occur, especially among those who are unvaccinated or have weakened immune systems. Chlamydia infection. You've just had unprotected sex with multiple partners, and unfortunately, that gives you a higher risk of contracting a sexually transmitted disease or another. One of the most common ones in the US is chlamydia, and you've caught it. The good news is that chlamydia is typically treatable with a round of antibiotics, provided you catch it early enough. If you're among the 10 to 15% who experience symptoms within 1 to 2 weeks, you might notice a burning sensation when urinating. This happens because the bacteria inflame your urethra, causing discomfort. As your immune system kicks in to fight the bacteria, pus may form, and you could notice a discharge when you pee. Unlike some infections, chlamydia doesn't go away on its own. The bacteria are sneaky, hiding within your cells without triggering your immune system's alarm bells. Left untreated, chlamydia can have severe consequences. After a few years, what seemed like a one-time encounter can result in permanent infertility, as the damage done by the bacteria over time may be irreversible. So, getting tested and treated early is key to avoiding long-term problems. Botulism. When food isn't properly processed or canned, it can become a breeding ground for botulism, a potentially fatal illness caused by a toxin produced by Clostridium botulinum. This bacterium thrives in low-oxygen environments like sealed cans that weren't heated sufficiently during processing. The neurotoxin it produces can cause muscle weakness, difficulty swallowing, and blurred or double vision. As the toxin spreads, it can lead to paralysis, starting with the muscles in the face and gradually moving down the body. If untreated, the muscles responsible for breathing can become paralyzed, leading to respiratory failure and death. Prompt medical treatment, including antitoxins and ventilatory support, is crucial for survival. Tetanus. Tetanus is a terrifying disease, made even more frightening by the fact that it is entirely preventable with vaccines. It's caused by a bacteria that produces a toxin, leading to muscle contractions that are so severe they can make it impossible to breathe. The bacteria enter the body through cuts or puncture wounds, such as those caused by stepping on a rusty nail or getting injured in an accident. Early signs of tetanus include muscle stiffness in the jaw, often referred to as lockjaw, and pain in the neck. As the disease progresses, muscle spasms spread throughout the body, causing intense pain and making it difficult for the patient to move or function. Without immediate medical intervention, the muscles controlling vital functions like breathing can become paralyzed, leading to death. Gardnerella vaginalis infection. Bacterial vaginosis, BV, is a common condition that affects many women at least once in their lives. It's caused by an overgrowth of Gardnerella vaginalis and other bacteria that upset the balance of the vagina's natural flora. Normally, beneficial bacteria produce lactic acid, creating an acidic environment that keeps harmful bacteria in check. When the balance is disrupted, the pH levels in the vagina become less acidic, allowing Gardnerella to flourish. BV often leads to a thin, grayish-white discharge with a distinct fishy odor. Many women with BV don't experience symptoms, but when they do, it can be uncomfortable. To reduce the risk of BV, it's recommended to avoid douching, practice safe sex, and refrain from using scented products in the genital area. Tuberculosis. TB is a highly infectious disease caused by Mycobacterium tuberculosis. It typically affects the lungs, but can also spread to other parts of the body. TB is airborne, spreading through droplets when an infected person coughs or sneezes. Symptoms of active TB include a persistent cough, chest pain, fatigue, weight loss, and night sweats. Some individuals may have latent TB, meaning they are infected but show no symptoms. If left untreated, TB can lead to severe lung damage, coughing up blood, and eventually, death. While TB is treatable with a long course of antibiotics, drug-resistant strains have emerged, making treatment more difficult. Legionnaire's disease. Legionnaire's disease is a severe form of pneumonia caused by inhaling water droplets contaminated with Legionella bacteria. The infection often begins with muscle aches, headaches, and fatigue, but as it progresses, symptoms worsen. A high fever, coughing up blood, and difficulty breathing are common as the bacteria take over the lungs. In severe cases, respiratory failure can occur, requiring the patient to be placed on a ventilator. The bacteria often thrive in warm, stagnant water, such as that found in air conditioning systems, hot tubs, and fountains. Legionnaire's disease can be life-threatening, especially in older adults or those with weakened immune systems, but it can be treated with antibiotics if caught early. Leprosy. Leprosy, a disease once surrounded by stigma and fear, is caused by the bacteria Mycobacterium leprae. It primarily affects the skin, nerves, and respiratory tract. The infection is slow to develop, with symptoms sometimes taking up to 20 years to appear after initial exposure. Leprosy spreads through droplets from the nose and mouth, typically during close, repeated contact with an infected individual. The disease causes muscle weakness, vision problems, and severe disfigurement, particularly of the face and extremities. In the past, people with leprosy were often isolated from society, but modern medicine has changed that. Today, leprosy is treatable with a combination of antibiotics, provided it's caught early. Left untreated, however, the nerve damage can be irreversible.